So, hello, good evening, everyone. Myself, Dr. M.S. Balakrishna, Professor and Head, Department of Oral Surgery. I'm the Dean Academics and one of the author of Dental Pulse book. So, very nice to see you people. Really excited about getting an MBA seat. Yes, dear students, please understand that you will have to work just around 11 to 12 months, 11 months. If you work hard for 11 months, the seat is yours. Many people start with a positive note, but they don't carry till the end. That is why they lose the battle in the middle and give up. So please understand that 1 year of the life you have to give now, and then the next 3 years in MDS. That means 4 years. So you work hard for 4 years and enjoy your next 30 to 40 years. Or enjoy now this 3 4 years and then struggle for next 30 40 years. Because the three words MDS, it's a magical word. By doing MDS, you can be a consultant to many clinics, whichever branch you want. You can work in any college, you can go abroad, right? So same work as a BDS and as an MDS, if two people come, always an advantage is given to the MDS. I was also BDS once, right? So same way, you are at the same place where I was somewhere around 20 years back. So I feel very happy to see that you people are really interested and want to make a difference in your life. Please understand that we live only once. Only once we live. So that once what we live should be the best. So Eden 2 is coming or has come with this trial period of 18 days program where you have 3 subjects. Okay. So oral surgery is the first subject which I am taking. So how we will be doing is today I will be taking a live class, basically more of theory oriented. And then whatever I have taught today, today and tomorrow you will study, and day after tomorrow I will have a pure session on MCQs on the topic. But today also I will be giving you 1 or 2 MCQ related to that, so you will know what to do with. So dear students, you have to really charge up, work very hard. First and foremost, you need to get a copy of Dental Pulse book, the latest edition. That is very important. What all things to be done, that will really help you for your entire preparation. Okay, so let's start now. Before starting, I would like to know I am audible. You can put it in the chat box. Am I audible? Yes, no. Is the slide moving? Yes, no. Please put it in the chat box. Yes, okay, fine. Thank you. Yes, so I would like to have an interactive session. Okay, so please keep the chat box very busy, and every question, whatever we will be doing henceforth, from day after tomorrow onwards, I want you to participate actively. There is no point just sitting at mum and doing nothing. Okay, others are answering, 2 or 3 are answering. Let us go like that. No, you have to actively participate. Then I will know how much involved you are. And this is for those students, those who really want an MDS with their name. The people who are not interested, just sitting here for a time pass, it will have served no purpose. So those people, I request better not to attend because it will be a boring for you. For an MDS, be here till the end. Okay, let's start now. So dear students, graduates, or you can call it interns, or you just come out from college, many of you, think 1,000 times before taking a decision. After taking a decision, even if 1,000 difficulties come, you should not change. And joining dentistry, you have already taken a decision. Now, even if 1,000 difficulties, you should not change. So please understand that so many of the people are there who at the very first shot, that is during their internship or 1 year after that, they bag the seats. It's only the last few days, the last few months, 4 5 months before the exam, which creates the pressure. And like in cricket match, you will see that last overs they will try to hit, right? So the run rate is increased during the last overs. Same way, you still have time, 5 to 6 months time for your exams, and those who are very freshers, you have 1.5 year apart from now. You can call it 1.5 year, plenty of time. See, everything is here. Please understand that. If you think that you can do it, you will do it. If you think you can't do it, then you have to change your mindset, and then things will happen. Let's start. Right. So before going into maxillofacial surgery, because a lot of question comes where the units are changed. Some units are in grams, some are in kilograms, some are in micrograms, some are in centimeter, some are in meter. So it is very confusing. And so we should know our basics correctly. So the basics is something like this. To change a Fahrenheit to centigrade, subtract 32 from Fahrenheit and divide by 1.8. This is just your school what you have studied. Nothing new in oral surgery. But you should know this. So this is how, if you have missed out in oral surgery, we will make sure you learn it from there. And to change Celsius to Fahrenheit, multiply Celsius by 1.8 and add 32 to it. This is very simple. Very important, 1 inch is equal to 2.54 centimeter. This will be useful in your extractions chapter. What is the height of the chair from your shoulder level? So they can ask you in inch, they can ask you in centimeter. But lower peak, where the headrest of the patient should be. How many centimeters from the patient's elbow? So that is again a question, you should know this. Then 1 ounce is equal to 28.35 grams. 1 lb is equal to 453.5 grams. This ounce and lb, where you will learn, especially in the chapter of fractures. In the fractures, what is the amount of force required to break the mandible? So you would have, so that is how the conversion, you should know this. And then 1 kilogram is equal to 2.2 lbs and 1 gallon is equal to 3.78 liters. This is very basic. You should learn this. It will be really helpful. You never know when this will save you. This is the starting slide, and this is the most important slide which will save you in many tricky questions. Okay. Now, oral surgery, when you start studying, so I gave you the basics first. So, oral surgery you can divide into easy topics and tough topics. Easy topics, extractions, sterilization, impactions, a little bit of cyst, all those things easy. Tough topics are your TMJ, orthodontic surgery, fractures, implants, and just segregating it. So always you should read one easy chapter and one tough chapter. Then you will have the balance correct. And when you are solving MCQ, please remember that you should not answer blindly. Always try to read the question very fast 3 times, 2 to 3 times. At least you should read. First time when you read, you will understand what subject it is. Second time, which chapter it is. Third time, you will actually understand what is the question being asked. Once you read the question, do not jump into an answer. Don't see the option. So whatever you have studied, close your eyes and think for an answer. And if that answer, you got it, then you see the options. In the option, that answer is there. That is the answer. Otherwise, what will happen is you will get confused. And because the values will be very nearby, so there are high chances of getting confused. So for every question, you need to work on, derive an answer, and then mark the answers. Okay, so let's start from the very basic sterilization. So sterilization, as you know, there is method of sterilization. So what is most important to us is the moist heat, that is autoclave, right? But if you read on auto, will not work. You should know the high yielding facts. So the moist. So what is the first question they can ask you in autoclave? what is the temperature? So this is a very hot favorite question, which is if you see any entrance question paper or books, most of the year this question is asked. Autoclaving is done at 121 degrees Celsius at 15 psi the pressure and for 15 minutes of duration. 15 minutes, 15 psi. So they have given everything correct. Just they could have changed 121 into 123 or 122 or 119. So you should be very clear about this. And the second method is 134 degrees, 30 psi for 3 minutes. Now see, if you observe these two values, like suppose you have kept milk on the gas. Milk in a container you kept on the gas. For 121 degrees, which is lesser temperature, you need 15 minutes to boil. But if you're increasing the speed of the gas, so it will burn very faster and the milk will boil very fast. So from 121, if you are increasing to 134, 15 minutes will reduce to 3 minutes. Please understand this too is always confusing. Okay, they can give you 4 options in this. One of them may be correct and one may be wrong, and this 134 degree for 15 psi for 15 minutes. That is wrong. 134 degrees for 30 psi in 3 minutes. So they will mix, match, and give. I hope you're understanding. Please put it in the chat box. Did you understand or not? Yes, no. Y for yes, N for no. Please put it. Then only we can go forward. Excellent. Excellent. Very good. Yes. The energy is very high and I want like this throughout. And so this is the autoclave. 2 temperatures, they can confuse you. And then called has 3 minutes flash cycle. It is best that for unwrapped instruments. So just for 3 minutes, you will autoclave it and take it out. This is for unwrapped. Suppose you are in the OT, an instrument, you have autoclave, you have done everything, sterilization, pouching, everything. When you're opening the pouch, it fell down or it fell on the green cloth. Even though green cloth is sterile, still you are not sure about it. Then you can do a flash cycle immediately, 3 minutes. So this is for moist heat autoclave. So we should not restrict our knowledge to this point. We should read in and around. Always, while preparing for an entrance exam, that question, whatever you are studying, that is not important. Around A, B, C, D, 4 options. Why A was not answered? And what will be the question if A is the answer? D. So like that, you need to know all the possible things. Then only your bulb will become on and your critical thinking will start. So know straight away by hearting. Next question. See, dry heat is done at 120 degree centigrade. Water boils at 100 degrees. We know that autoclaving just now we studied 121 degrees. Oil bath 175. Very, very important. This is done for endodontic instruments. Oil bath. This question, oil bath, is repeatedly asked in various entrance and it's a very hot favorite question. If you see Dental Pulse book, when this question comes, so many years this question would have come. So oil bath 175 degrees and gas sterilization is 10.8 degrees. So this is the relevant. Just that you studied autoclave by heart at 121 degrees for 15 minutes, 15 psi. No, that is wrong. Only that you study, it is wrong. You have to study this table also. So this is how you have to think and study. Next, antisepsis and disinfection. So alcohol acts as an antiseptic and disinfectant. Our, what you say, sterilizers, what we have used, right? So sanitizers and all what we have used. Alcohol is acting as an antisepsis and disinfection at 70% concentration. Hexachloroquine is at 3%. Iodine and its compound is 2 to 5%. Very, very important. Hydrogen peroxide, you will see in your conservative department, 3%. These values are so important. Chlorhexidine, 20. Betadine, the Violet color liquid, what you have? 7.5% povidone iodine. Extremely important question. Cetrimide, 0.5%. So these are all MCQ questions which has been asked in when AIPG was there, Comet K was there, and the NEET has come. All those questions in and around is clubbed and kept here. These are all questions actually once in a year. All these were asked. So if you read standardization, first is you should know the classification: physical methods, chemical methods. So these are the takeaways what you should study. So first you will study the classification. Then each method you will study in brief. You will study autoclaving detail. That is, autoclave is two temperatures, right? And then at what temperature you will heat, that is heat, oil bath, and this is the percentage or the concentration what is required for antisepsis and disinfection. Now, dry heat. So, dry heat sterilization is also called as hot air oven. Our autoclaving is moist heat. So, that is a different thing. So, your dry heat sterilization is also called as hot air. And what do we here? Sterilize here? Hand pieces, your micromotor, oil, powders, paper, clothes, hot air oven. And it is a very slow method. 121 degrees for 6 hours. So it requires 6 hours. And the other temperature for the same slow method is 160 degree for 2 hours. As I told you, increase the temperature, the duration comes down. So dry heat method, 121 for 6 hours or 160 degree for 2 hours. And the advantage is it will not rust the instruments. This is dry heat. Next is your chemical or cold sterilization. Cold. So this cold sterilization is a slow method and it's like an overnight storage. So suppose tomorrow is the surgery morning, 9 o'clock, 10 o'clock. So in the department or in the OT, the sister will wash the instrument, they will sterilize it, they will wrap it, sterilize it, keep everything clean. That is one method. That is for the dry heat and autoclaving, they will do. But when you go for cold sterilization, you will wash the instruments and in a tub, you put this instruments in a tub and you will pour this chemicals. And overnight it will be stored. Morning, sister will come, take out the instrument, wash it again, and then autoclave it. So it is mainly for disinfection, only disinfection. And what is that solution used here? That is isopropyl alcohol. Isopropyl alcohol, 70 to 90%. So this is the MCQ. Isopropyl alcohol. So it will not rust the instruments. And what are the other alternatives? Other alternatives are here. Benzyl alkonium chloride, 2% glutathione, 5% hexachloroquine, 8% formaldehyde. In all of this, you should remember two things: isopropyl alcohol and 8% formaldehyde. These two aims, if you know, more enough for the time being. So this is your chemical or cold sterilization. Then you have got gas sterilization. So gas sterilization, this is used for heat and water sensitive instruments. What is the gas we use here? Ethylene oxide. So that is the MCQ what they will ask. And this gas more than 3% can act as an explosive in nature. So we discussed about dry, chemical and gas. Then fourth one, the last one is chemiclave. Chemiclave. Chemiclave means chemical vapor sterilization. So we have got formaldehyde plus alcohol plus water. So this combination we use here. Now, one MCQ I am giving you, but a detailed section on MCQ. Why A is the answer, why B is the answer, why C is not the answer, why D is the answer. Like that discussion we will do on our next class, where we will dissect and study each and everything. This is today is just a warm up, just for your warm up I am giving. So I would like you to answer. You may be wrong, no problem. In the beginning, no one knows. Please answer in the chat box. Which of the following is the most commonly used disinfectant dental units and hand feeds. Just now we have discussed. Just answer. Try to answer. You may be wrong. No problem. Yes, please try to answer. A, B, C, D. Yes, I'm still waiting. Okay, I feel you've not studied. No problem. Right. So, yes. Yes, answers are coming now. Okay. Very good. It's coming now. So, which of the following is the most commonly used? So that is your glutaraldehyde. Just now we have discussed that glutaraldehyde. And why glutaraldehyde? You already know, right? And the other answers are not only glutaraldehyde, other options are also there. Yes, now answers are filling up, right? So while we study, when we are solving an MCQ, directly answer you should not know. That I will teach you next class how to build, how to derive an answer. Even if a question you have studied, you, suppose a chapter you have not studied, a question came, but you know something is an answer and you have a gut feeling. How to make your gut feeling into confident feeling and yes, derive at the correct answer. I'll talk on that psychology part or that science part in the next class. Every time you may not be correct, but most of the time you will be correct. So that I'll talk in the next class. Okay. So blood disorders not required. I will directly go to the extractions and impactions today. Okay. So just give me 10 seconds. Yes, let's come to extraction. So basically, it's a theory class today, and MCQ is the next class. Okay, so extractions. Now, you see an X-ray here. See, now in extractions, you as a BDS student, what you have studied, the definition of extraction, indications, contraindications, chair positions, complications of extraction. But you see now how questions are twisted and coming. I will discuss the main points. Basic things is just in your synopsis you will study. In the addend to notes you will study. The ones which are complicated I will be discussing. So with whatever knowledge you have, just see this X-ray. This is the third molar and there is a fracture line over here. Now during the treatment of the fracture, should you remove this tooth or you should retain this tooth? That is the question. So the fracture line, should you remove this tooth or retain the tooth? So what is the answer? Now this is a fracture. Fine. That's fracture is C. If this tooth, third molar, is grossly decayed, displaced, mobile, then you will have to remove it. Because if you remove this tooth, what will happen? First of all, there is a fracture line over here. And you remove this tooth also. So much bigger area, bone will not be there. So greater area, divide of bone will be there and plating has to be done on a larger scale. So if the tooth is decayed, mobile, infected, remove the tooth. But even after fracture, the tooth is intact, non-carious, then retain the tooth. So this is how the question you will have to read. Okay, should you retain or remove? It's all, it will be in one line. How the question will be given, an XYZ person with so and so age, whose INR values is so and so, which has got nothing to do with the question, came for an extraction of 4A. 3 days back he met an accident or trauma, which was able in all those things, and OPG was taken, and later oblique view was taken, and it was diagnosed that it was full cut and cut fracture. So, what is the line of treatment for the retention of the forehead? So, you everything is fracture based. So, you feel it's a fracture based question, but they just ask you, will you take the tooth or not? So that is how you have to. The questions generally, the new pattern of NEET is only. Over a period of practice, you will come to know how to solve those things, and it is very simple. I am telling you, it is my experience which tells that it is simple. But initially, you may find it little tough. But I, given writing, it is easy. It is easy. It's only practice, practice, practice. When you do, it becomes easy. Okay. So the 7 essentials of extraction. Whenever you're going for an extraction, you should have 7 things in your hand. Radiograph. Then that is called as Raffles. Okay, Raffles. The name of a person. So that's a code word. Raffles. Radiograph you should have. Anesthetic agent. Forceps and elevators. Flat trace, light, efficient assistance, and suction apparatus. So these are the basics of extraction. Now, mechanical principles of extraction. So whenever you're going to extract, the first principle is expansion of the bony socket. Second is use of lever and fulcrum. And third is insertion of wedge and wedges. So these are the extractions, 3 principles what you should know. This is the place in the extractions what they catch every student. Okay. So the lever principle, wedge principle, wheel and axle. This you would have studied under undergraduate. I am having no doubt. You would have studied length and breadth, and I think it would have come in your exams also. So the application point they ask here now. So you have a fulcrum here, and then you have got the power and the weight, right? So power what you are putting and the weight is the tooth which you are lifting up, right? So this is the most commonly used principle, lever principle, and it is called first order principle. And the fulcrum, what you're seeing is here, it is in between the effort and the resistance arm. So similarly, wedge principle and wheel and axle principle. Today is a demo class, so just talking just the basics of here and there. In the detailed class, it will be dealt in depth. Now, they say that lever principle has a mechanical advantage of 3. Right. Wedge principle has mechanical advantage of 2.5. And then your wheel and axle principle has a mechanical advantage of 4.6. What is this? What is this 3? What is this 2.5? And what is this 4.6? That is how they ask the questions in the exam. Right. For example, now I am a person, I am a doctor, I am going to extract the tooth. My weight is 60 kilogram. Okay, my weight is 60 kilogram. So when I am holding the tooth, the forceps, and I'm putting the pressure, so on the tooth, if I am using wheel and axle principle, my forceps is using wheel and axle principle. I am 60 kilogram. 60 kilogram weight is kept using wheel and axle principle, and wheel and axle principle mechanical advantage is 4 is 60 into 4.6. So that is equivalent to 240 point something. 640 into 6, 240. So around 250.6 is also there. Around 250 kilogram weight is there on the tooth. That is why they say while elevation, you should always have the support. You should support the mandible. You should support the adjacent tooth. You should hold the tooth what you are extracting. If you just do an elevation like this, other tooth may also come out. That is why with the left hand, you will stabilize the mandible. Otherwise, mandible fracture will come. You are just 60 kilogram. But the instrument, the crossbar what you are using, the winter crossbar, utilizes 4.6. On the tooth, 250 kilogram force is there. That is enough to break the mandible. So, see, we have studied all the principles of extractions, right? Your supporting hand, how it should be, stabilization of mandible. Everything has a meaning. It is just not just it is given and you have to by heart. So now what you should know. First thing is the mechanical advantage I told you. Second thing is which all instrument uses which all principles. You've got apex elevator, you've got crossbar elevators, you've got two plant elevators, whether it is lever, wedge, or wheel and axle. Or they will give you a question which of the following uses wheel and axle principle. Instruments, four names they will give you A, B, C, D. So we should learn that way. Principle and which are the instruments. One. And the other way, an instrument may be given which principle it uses. Second method of studying the same thing. And the third, the mechanical advantage. And fourth, the same mechanical advantage can be given in the form of grams, ounce. My first slide, which I told you, conversions, what I told you. So that way it can change also. The same thing, you can four different ways they can ask you question. So the lever principle, which all instruments? Straight elevator, your crane pick elevators, wheel and axle elevator, Watts elevator, Winter's crossbar elevator, winter elevator, not crossbar, winter's elevator, triers, winter triers, and wedge principle. I'm sorry, wheel and axle is winter crossbar elevators, and wedge principle is apex elevators. So someone uses 3, someone has mechanical advantage of 2.5, and someone has 4.6. Wheel and axle has got 4.6. So that many times it will be multiplied. So I hope you understood now. What is the actual meaning of mechanical advantage? Yes, no. Please put it in the chat box. Please put it in the chat box. What is the real meaning of studying this basic thing, right? We would have studied in dentistry so many years, right? But still, to be very honest, when I was a BDA student, I just marked it, I just studied it, some principles. What is that principle? And the details of what is the fulcrum, short arm, long arm, that we will be discussing in our long classes. In our detailed classes, it will be there. For a short period of time today, it's not possible to do everything. So that is one aspect what we should be studying. But still, you are getting an advanced knowledge. So crossbars 4.6, this elevators 2.5, your extraction forceps 2.5, your premolar forceps, your cow horn forceps, whatever forceps till now you have done the extraction. It uses mechanical advantage of 2.5. So if you are 50 kilogram person, you are 50 kilogram, 50 into 2.5, 50 to the 100. So almost like 105, 110 kilograms weight is kept on the tooth. Still 100 kilogram force is huge force. That is why the tooth comes out from the extraction socket. The periodontal ligament breaks and you take it out. And the methods of removing apical, lingual, buccal, lingual, buccal. So movements and all basic things, you know that. In the detailed class of extraction, everything is discussed. So there are two types of extraction, British technique and American technique. Right. So generally we follow the British technique. You should be knowing the chair positions. Your first quadrant, second quadrant, third quadrant, fourth quadrant, whichever quadrant. When you are administrating local anesthesia, you will stand in front of the patient. And then only while extraction of the fourth quadrant, we will go behind the patient at level of mouth. Right. So this is the position. These are the very basics. You know this, right? And there is a very important role of the supporting hand. Always, it should be like one like cricket ball. You see the ballers and all how they hold the ball like this. So it's like this. So when you're having these two fingers, one will retract the tongue, one will retract the cheek, and one will stabilize the mandible. So like that, you're separating both and stabilizing the mandible. That is how you should do this. You see here, the first finger, forefinger is retracting the cheek, other one is depressing the tongue, and the thumb is stabilizing the mandible. Why to stabilize the mandible? And you see that students do so wrong. Just they have done some 10, 15, 20. Today you understood how much force is being kept on the tooth. It's very dangerous. Now, what is the order of extraction? Patient comes for multiple teeth extractions. So, what is the order? This is a very hot favorite question. So, always remember you should extract the upper tooth first, then the lower tooth. Upper first, right? Why upper first? Why not lower first? Now, suppose if I extract the lower teeth first, so the socket is open. Even if you have sutured it, still there are chances that when I'm after second time when I'm extracting upper teeth, if some spicules break up, it can go inside the socket and it can get infected. So it's always remember upper first, then the lowers, and the most posterior teeth first. Multiple extractions are required, right? Maybe a periodontitis case, so a lot of teeth are moving. Upper first, then the lower. In upper also, the most posterior teeth first. The order of extraction is 8, 7, 5, 6 is not extracted first. Okay, 8, 7, 5, 4, 2, 1. Your 6 and 3. These are the cornerstones of your mouth, of the jaw. Cornerstones. In the 6, where the tooth is there, it is like the maxillary arch is taking a curve over there. So there is an angulation turn over there, and lot of bone is there. So it is little difficult to remove 6 intact. 5 is there and 7 is there, and your right policy is take out the neighboring 2. 8 you will remove, 7 you will remove, 5 you will remove, 4 you will remove, 2, 1. And then you can remove 6, that is your first molar or canine or first molar. That is the order of extraction. Please do not forget. Same way for lowers also. So that is your order of extraction. Next question, very, very important. Height of the teeth to be positioned for extraction. So it's extremely important. Now your height is, so the chair we will be changing according to our height. And again, the mistakes what people do in the college is, however is the chair, they will just come and do it. See, when you're driving a car, the rear mirror, right, everything, the driver seat, everything is adjusted according to the height and the length of. Otherwise, you copy, someone else would have, a taller person would have come, he would have kept long distance, and you will be struggling if you are a short person. So whenever you are doing extraction, first adjust the chair. If you are going to extract a maxillary teeth, so this is your shoulder. The teeth to be extracted should be 8 centimeter below, and I have told you 1 centimeter is equal to, sorry, 1 inch is equal to 2.54 centimeter. 1 inch is 2.54 centimeter of a slide conversions. So the chair should be adjusted. The tooth should be 8 centimeter. So 8 centimeter is 3 inch. 2.54 centimeter is 1 inch. So 3 inches is equal to 8 centimeter. So the tooth to be extracted should be somewhere here. See, I'm wearing the teeth which has to be extracted. So when the patient is lying down, the tooth to be extracted should be at this. So if you're a short person, reduce the chair. If you're a tall person, increase the chair. Whatever it is, maxillary tooth should be here. And if you're extracting the lower anteriors or lower teeth, anything, this is your elbow. It should be around 16 centimeter down, or almost like 6 inch below your elbow. Like when you wear a chudidar, right? Kurta and all. Kurta, some half sleeves will be there. Long sleeves are like here. Some 3/4 sleeves are there. Half sleeves is again here. 3/4 sleeves. So till the here lower teeth. So when you're standing, the tooth to be extracted will be at your 6 inch below the level of operator's elbow. That is 16 centimeter. See again, inch, centimeter, they will give confusion. Extremely important. Now, for example, I want to extract 2 premolar teeth, lower 4 and 5. both of them have to be extracted. So I take a periosteal elevator, I go and give a 360-degree tilt. One tooth you are going to extract, you will hold it, and only the tooth to be extracted should be pushed. But here both has to be removed. You just go and give 1 360-degree tilt, both the tooth will jump out. So that is called Stobie's method of extraction, when two adjacent teeth has to be removed at a time. And rubber band extraction, when you don't have to do much of what you say, retraction of the gingiva. So that is the time where rubber bands are kept, and you will with the rubber band slowly you will go down, and you will separate the gingiva from the tooth. See, when you're doing extraction, after giving LA, what do you do first? You take your periosteal elevator or Moon's elevator and reflect the gingiva. My question to you is, what is that motion called as? I repeat, this is the tooth, this is the gingiva. After giving LA, you reflect the gingiva, right? Then only you will extract the tooth. What is this removal of the gingiva or separating the gingiva known as? Please put it in the chat box. If you don't know, write no. No. I will answer. But please answer. The separation of the gingiva from the tooth is called what? During extraction. Yes, I'm waiting. Be quick. You're all active. If you don't know, write no. No. I will answer. Okay, very good. One answer has come. They said no. I appreciate this. This is how you should be. You should be very clear. If you know, no. If you don't know, don't know. This acting business should not start. If you act, you will be fooling only yourself. First of all, please remember, kids, there should not be any shame. I don't know, sir. What is there? I don't know. That is why I am studying here. If I know everything, I would have done it myself. So that is how. Very good. I really, reflection is not the word, but still a good try. Very good try. I'll come to that. Gingival retraction is okay. That is, you can call it, in perio you call it, but not in extraction. Yes. Any more? 4-5 people have to know. Very good. I appreciate that. This shows how honest you are. This is the one which will make you learn. Please understand. Honesty is very important. And the answer I'll tell you, retraction of the gingiva, very sorry. Retraction of the gingiva with your periosteal elevator. That motion is called prying motion. P-R-Y-I-N-G. Please write it down. P-R-Y-I-N-G. Prying motion. See, all of you have, and we have studied BDS. From third BDS onwards, surgery posting is there. Third year, part 1, part 2, whichever scheme you are, it is there. Internship also done. Still, many of us are hearing this for the very first time. Right? So, what you say? The mistake is not that you don't know. The mistake is you're not ready to know what is being taught. So now, sitting in this class, you came to know one new thing which you are always doing. And it's a very simple thing, which is nothing rocket science over that. So, see extractions, chair positions, order of extraction, height of the tooth, where it should be, Stobie's method, rubber band extraction, all these things, supporting hand, and how much force you have to use. These are all right. One MCQ we will see if you can. Very good. If you don't know, no problem. No one knows the thing. All of the following statements about inhaled tooth fragments are true except. See, these are very confusing. So out of 4, 3 are correct, 1 is wrong. Right. Directly I'll come. It enters the right bronchus. True. Whenever a fragment goes inside, it goes into the right bronchus. The architecture of the respiratory system is that everything goes into right bronchus. This is a new learning method for you. And if the tooth is there in the lung and if it is infected, lung abscess can come. Very true. Then it may cause bronchiostasis. In future, if you're not removing that inhaled tooth fragment broken down, so if the patient aspirates the tube, don't think that it has gone into stomach and everything is over. You have to take a chest X-ray. A tooth part is missing and patient aspirated, chest X-ray to rule out it is not there in the lungs. So usually right bronchus, lung abscess can happen, bronchiectasis will happen. And then it may be coughed out spontaneously, no treatment is required. That is not. This is the wrong answer. Right? This is the wrong answer. This is not the correct. It will not be coughed out. Right? So this is again very important. While doing extractions, you should be sure patient should not inhale the tooth. If inhale, take a lung chest X-ray. Right, this I think you can answer. The most posterior teeth are removed. Can you answer this? The most posterior teeth are removed. Least, maximal, last, first. Very good. All of you are answering correct. Yes. So see, this is what it is. B is the answer. Very good. All of you are done correct. So this is how we will be discussing the theory part first, and from the theory part questions we will derive, and then we will be solving the answers around that and explanations related to that. This you should answer. The mechanical advantage obtained from wheel and axle. We got lever, wedge, wheel and axle. Three principles were there. What do you think? Very good. Answers are coming very fast and extremely good rate. Please think and answer. Don't be so quick also. Okay, read the question 3 times. See, I will be telling you do. You should not forget the basics. Read the question 3 times. Then only answer. Otherwise, in panic mode, you will go wrong. Yes, all of you have done correct except one person. Wheel and axle is 4.6. Right? It's not 2.5. So, and this we have already discussed. Same thing. And the instruments also, rather than asking axle, they will say Winter's crossbar elevator uses which type of principle. Right. So all these things are there. We'll do it on a slowly. Little bit about impactions I'll tell you. So extractions, these are the highly important things. Rather than reading definition, classification, and all this indications, contraindication, these are the areas where you have to focus. And even this, the numbers, 14R, 14L, what does this signify? Right, all these numbers also you should be knowing. And they can give you the photograph of an instrument. You have to identify that. So all those things are there in the app. Once you open the app, a lot of questions, picture-based questions you will get. App means head into app. Okay, in the head into app, a lot of questions are there simulating this. Mock tests are there. So impactions. So again, the first question is the frequency order of impactions. So obviously, the third molars, which you know that, are the most frequently impacted. Mandibular third molars, most frequently. Then maxillary upper third molar, or first is mandibular, then is maxillary third molar. Then maxillary canines, then mandibular bicuspids, mandibular cuspids, maxillary bicuspids. So this is the order in which the impactions happen. Now, I'm giving you a very simple tip. When the patient is walking into your clinic, I see the patient from a distance without talking to him, without interacting. From a distance, maybe one glass is there, the patient is on the other side of the glass. And when he's walking, you are just seeing him. By seeing him from a distance, you can tell whether the impaction, if he's having, is going be easy or tough. Without seeing his tooth, without knowing it is mesioangular, distoangular, or charge more. So before only you can tell how it is. See, if it's a short person, height short, so the mouth opening also will be small. So small mouth opening, the mandibular retrusion, limited access. Even though the impaction is the easiest, mesioangular, the easiest, or vertical, easiest, but because of restricted mouth opening, it's going to become tough. So small people, if they are coming, always tell them prior. It's going to take little more time, so don't panic. You come out, the tooth will come out, and charges are little more. Whatever you want, you can tell like that. And if it's a tall person, large mouth will be there, mouth opening will be very wide, good access will be there. It's going to be, even though it is a horizontal or distoangular impaction, still because of very good access, you can see the teeth, you can reach the teeth with your micromotor, you can remove that tooth. So the magic is nothing, height of the patient. Tall people easy, short people little tougher. Then when you take an IUPA, right? You always take IUPA, right? The third molar tooth is there. Behind the third molar, one white line will be there in IUPA. Next time onwards, when you see IUPA, just go and check that. A proper IUPA I'm talking. One white faint line will be there. What is that white faint line? That is external oblique ridge. Today, after this class, go to Google Images and see an IUPA.
അയാള്
And then you will
ഫുള്ള്
get
നടത്തിച്ച് എത്ര നേരെ നടക്കുന്നത്. അയാൾ ഉച്ചക്ക് 2:30 എത്താൻ പോണെങ്കിൽ
is behind this new. Yes. Now the tooth is there and your external oblique ridge is there, like this L shape. This is the tooth. IOP is like this, of faint line. So if the ridge, external oblique ridge is behind the tooth, so tooth is front and the external oblique is behind. This is the external oblique ridge which is behind. Then you have got good access. You can remove the teeth very easily. But if this external oblique ridge is along the tooth or in front of the middle of the tooth or like this, it's going to be very tough to patch. So just by seeing the IOPA, suppose you are working in a clinic, you want to tell the consultant, oral and maxillofacial surgeon, and the patient is yours, it's your clinic, you have to tell a right to the patient. Just by seeing an IOPA, you can tell that, you can understand that this is going to be little tougher cases, you can charge 1,000 rupees more. Because later on, when the oral surgeon comes and tells, why did you charge so less? This is a very tough case. Then you can't change the rate for the patient. And if you change the rate, patient trust goes up. So that is how your little knowledge, what you're understanding now, make big impact. Your clinical practice also will become extremely good. So did you understand the height of the patient? Good access, bad access. External oblique ridge, good access, poor access. Did you understand this concept or not? Yes, no. Chat box. Be little quick because we have very limited time. We will go very fast. Very good. Thank you. Next question. Mostly what they ask in the exam is this area. Very good. Thank you. This area. Radiological assessment, what all X-rays you can take. You can take extraoral lateral oblique view, OPGs, IOPA, which you have studied in radiology also. Right? So these are the 3 X-rays what you do. One more Feller-Gregory classification. I did not explain this. Class 1, class 2, class 3. Right. So these are all the things which is easy for you. But in our detailed class, we will discuss all these things. Okay. Position A, position B, position C. Where is position B and where is position C? How deep it is? Then Winter's classification based on the angulation. White line. Now see, this is the, even though drawn in black color, but this is the white line. So this tells a line which is drawn on the occlusal surface of first molar, second molar, and it goes backward. It indicates the difference in the occlusion level of the second and third molar, how deep it is. How deep it is. And it tells the inclination of the third molar. Inclination. So what you have to do, the second molar, you have to draw perpendicular in the midline. Like this, perpendicular. And this third molar is at what angle? It is mesoangular, distoangular, vertical, inverted. So you'll come to know that. So white line indicates the difference in the occlusion level of second and third molar. That is first significance, and second one, it is the axial between third molar, how it is tilted. Then you have got amber line. You see this diagram? You have got the white line and a line drawn on the interdental area. Amber line. You see this animation. This is your amber line. So this denotes amount of bone covering over the impacted tooth. Now see this. This is an IOPA. Just think that this is an IOPA. So this is the line you can draw. You can trace it with the butter paper. You can put it and trace it. So how much bone is above the white line or amber line? Sorry, how much? This is the amber line. How much tooth is above? If it is like this and the tooth is little bit is shown. So when you give an incision and reflect the flap, even the tooth is inside the gums. When you reflect the flap, only that part of the tooth is seen which is above this amber line with your naked eye. And the part which is below this amber line is covered with bone. So you have to do the bone guttering and remove, expose the tooth and then take out the tooth. I hope you understood what I am telling. The tooth which is above that amber line is seen with the naked eye. That means the bone has not covered, it has erupted more. And the part which is below is completely the bone. That is amber line. And the red line, from the amber line, a perpendicular is drawn here. That gives the point of elevation. So you should measure this. Up to 5 mm, it's okay. After 5 mm, every 1 mm increase in this red line, if it is increasing, the extraction becomes difficult 3 times. More difficult. So that is why always you should insist for an IOPA for impaction. Never ever be overconfident. It looks easy, but you may anytime land up in trouble. So always take an X-ray, measure, calculate, do a little bit of homework, and then tell the rate accordingly, then tell a time accordingly. If you say very easy, 20 minutes I will do it, and you are struggling for 45 minutes, 1 hour, patient will lose the trust on you and negative publicity he will do. That is why these IOPAs are extremely important. You think what is there on IOPA only, but this creates magic. You tell the patient this is going to take 45 minutes and 1,000 rupees more it will be charged. Our consultant will come or I will be doing it. But please have patience. Patient is told he is completely in cool mode. He will not make any fuss. If you pre-tell, how to pre-tell? By all these methods which you have studied, but never implemented in the practical life. Relationships of the root to the canal. So it is for the impactions, extremely important. Your effects of the tooth will be there, whether it is touching the canal, it is not touching, it is superimposing, or it is behind, or it is one root is this side, another root is that side, the canal is going in between, something like that. So that is extremely important. Not involving the canal, changes, rules, or related with changes in the canal. So this is the classification. So this is how the photographs will be given, and you should tell which classification it comes. Right, so this is all, we will discuss it over a period of time. Slowly, we will do this. Then questions are based on that. Okay. So that's it. So we had a small session today, an introduction session where we discussed about sterilization, then extraction, so many concepts in extractions we discussed. We started with impactions, the beginning part of impaction, the classification only. So many questions we have discussed, right? So this is how we will try to solve some MCQs till whatever we have discussed the theory part on our next class. The timetable is there with you. Okay. So please read this well. And next class, I will be giving to MCQ telling you to solve irrespective of your right or wrong, no problem. Please try to answer, and then we will decode and dissect that answers. What is the question? Why A is not the answer? Why B is the answer? Why C is not? Why D can be or cannot be? That way we will be discussing. Okay, so that's all for today. I hope you had a good session, a good constructive session, right? Yes, no, please put it in chat box. You had a good session. Yes, no. Yes, thank you. Thank you so much. So definitely we are going to, this is just the beginning, okay? This is just the beginning. Please understand that. There's a long way to go. So step by step, step by step, step by step, we will try. So let us grow together. Okay, so we make sure we will go together, and you should always remember that your MBA seat, your dream branch, whichever branch you have, your dream favorite and dream college, that should be here. If your mind understand that, then nothing can stop you. And no procrastination. I can do it or not. I may not be. I was never a topper in the college. All those things doesn't matter. In NEET MDS entrance exam preparation and to get a seat, your talent is not required. Only your hard work is required. If you are ready to work hard, I assure you, you will get a seat. Right? We will make the seat happen together if you are ready to put in hard work. Okay, so next class we will meet up again. Please study well, and we'll try to solve a lot of MCQs, and it will be a lot of fun in that. Okay, so that's it. Okay, bye bye.